Healthy living. Chronic obstructive pulmonary disease, or COPD, is not something you hear about every day. It is a common lung disease that makes it hard for you to breathe. Now, it's possible that you could have it and not even know it, but it affects the ability of how much air your lungs can hold. Here to tell us more about COPD and emphysema is Express Care's Dr. Jitka Lom. Thanks, Doc, for coming in. I'm glad I don't have to say that 5 times fast. It's a mouthful. So what is COPD?
Well, as you said, it's chronic obstructive lung disease. Just to explain, when we're breathing, we breathe in and we breathe out, and we don't think about it. It's something that happens while we're doing other things. People with chronic obstructive lung disease have a great deal of difficulty breathing out. That exhalation phase is really hard for them. If you want to experience what that's like, try breathing through a straw. Take a drinking straw and breathe in. That's easy. Breathing out through the straw is very difficult. You have to force the air. And that's what a person with emphysema will feel. So there's a lot of work involved in just breathing in emphysema. The other 2 components of chronic obstructive lung disease, or COPD, are chronic bronchitis, meaning they're constantly coughing up phlegm and sputum, and basically hacking all the time, cupfuls and cupfuls of sputum per day. And the 3rd component is asthma, where the airways are quite twitchy, and what will happen is that they'll be irritated, and especially by cigarette smoke, and the airway will kind of clamp down, so again it'll be very difficult to exhale. So that's the common component of COPD, is that people basically have air trapping. They're not able to ventilate. They can breathe in okay, but they cannot breathe the bad air out. It gets trapped and they get into all kinds of problems with their metabolism because of that.
Okay, so let's talk a little bit about how do you get it. You mentioned smoking.
Yeah, smoking is the #1 cause, and worldwide this is the 4th leading cause of death around the world outside of infections. Anyway, so to deal with the reason why, smoking irritates the lungs and causes a lot of inflammation, and then people get into a bad cycle of basically mucus, pus, and immune system problems in their lungs. Emphysema also, the cause of that is actually breakdown of the lung. Normally your lung is like a sponge, a nice firm sponge, the kind that you use to wash your car with, you know, that kind, really firm. And in emphysema, the little walls of that sponge get broken down, so you have a lot more air and a lot less sponge, meaning a lot less lung to oxygenate you, and that is again aggravated by smoking. The other things that would make it worse are air pollution and certain other conditions that you're born with, like cystic fibrosis.
Okay, and so how is it diagnosed?
Well, you know, typically this is a disease of older people who have smoked for a while. So over the age of 40, they start coming in with cough. 1 month cough visit, a couple months later they come in again with cough, another round of antibiotics, and once you've had 3 or 4 coughing episodes like that per year where you need antibiotics all the time, it starts to become apparent that you've got some bad lung disease, and you end up with a chest x-ray and some lung tests, which we call spirometry or breathing tests, where you breathe into a tube and we see how is your lung volume, because as you mentioned at the beginning, you actually lose the volume of your lungs. And so over time it becomes apparent that you have a chronic condition in your lungs.
So I was reading that COPD, there is no cure for it.
Right.
I mean, I guess once that damage is done, it's there.
Yeah.
So how then do you treat it?
Right. So exactly as you said, once you start this process, it's something that's like a train, and all you need to do is try to slow down the train. And we do that with medications, treating people with antibiotics when their sputum starts turning green or yellow, steroid medication to calm down the inflammation of the lungs, and then inhalers, and they have to constantly be using inhalers to help open up the lungs and to reduce the inflammation in the lungs. Of course, quitting smoking is the most important thing that they can do, and stay away from secondhand smoke as well.
Okay, so what is the difference when we talk about COPD and then we talk about emphysema? They both kind of seem linked, but is there a distinct difference?
Yeah, COPD, we tend to use it more for the people who have chronic bronchitis. They're kind of chubbier, bigger people who are coughing and hacking up large amounts of sputum, and they always, you know, have those kind of symptoms. Whereas the person with emphysema, remember, they lost a lot of their lung volume, a lot of the sponge part of their lung. Those people are just sitting there working really hard just to breathe. They don't cough as much, they just have tremendous shortness of breath, and weakness. You know, they just use so many calories every day just for the work of breathing.
So is the treatment different for emphysema then?
It's a little bit different because they won't be getting as many steroids. They basically get oxygen so that they can oxygenate their blood.
Okay, and then I wanted to ask, does diet and nutrition play a role then in either one of these?
Yes, in both actually. It's really important that people with chronic lung disease eat well, nutritious, high protein and high calorie foods. That's different from what we tell most people because again, their lungs, just breathing is so much work for them. And so they have to eat well, eat large amounts and frequent meals so that they can keep their nutrition up. And they also should eat, they should take vitamins and take a lot of magnesium supplementation to help their lungs be as healthy as they could.
Okay, and I'm sure exercise plays a good factor as well.
Exercise is a tricky one in COPD because you do need exercise for circulation and for general health, but at the same time, it's so much work for them to breathe. Right. You have to balance that out. So they cannot do any extreme activities, and also activities like weightlifting or straining, those things are not good for them. So light exercise, but mild, yeah.
Okay, all right, gentle. Thanks, Doc. We will pick up our discussion on COPD and emphysema when Healthy Living returns. Stay with us.